Hello, you guys. I'm going live at a time I never go live, but I'm here with one of my favorite people. This is Dr. Willey. He's my functional medical doctor. So many of you guys have joined my page because I've been sharing my journey about perimenopause, and so I obviously am not a medical professional at all. I just share my own story. So
I just play what I'm doing.
So we're bringing a medical professional on. Okay, I'm going to try to read your comments as Dr. Willey is talking, but we're going to kind of just jump straight into it because I know that Dr. Willey is very busy, and so we just appreciate that he is here giving us this information. So, Dr. Willey, tell us about, can I just call you Warren?
Okay. Please, yes.
Warren and I have known each other for a very long time, so it's hard for me to say Dr. Willey, but I want to,
Remember, doctor's my job, not my name.
That's right. We love him around here. So, okay, tell us, what is a functional medical doctor? I get that question all the time. In fact, I get people mad at me for saying that someone that is having hormone issues should see a functional medical doctor. So why?
We just view things differently. A lot of us are MDs, DOs, DCs, chiropractors, naturopaths, NDs, but we look at things differently. The functional medicine world comes from the world of anti-aging back in the 90s. And then we called it regenerative medicine, then we called it rehab and rehabilitation medicine, and now we call it functional medicine. And basically what it is, we like to look for the reasons why people are ill, and not just treat symptoms.
Yes.
That's really the big crust of it. That's the umbrella of functional medicine, is find out why someone's having these issues, treat that, not just the symptoms. Because in Western medicine, we are really good about giving you a drug for every complaint you have.
Right.
Does that fix anything?
No.
We usually cause a lot
more problems. I was going to say,
yes. Yeah. So that's functional medicine.
So tell me this, because I get a lot of women that are like, I went to my doctor. We're going to just jump in. I went to my doctor. They say I'm too young, right? Or I went to a general practitioner. I went to my OB. Tell us why maybe someone should go to a functional doctor versus that, or tell us the difference maybe.
Sure. I think traditionally trained physicians and medical providers, that means mid-levels too, NPs, PAs, we're taught that women don't really go through menopause till they're 51. That's the average age in our country. Menopause is defined as a clinical event, and that's the cessation of menstruation for 12 months.
Okay.
But in reality, and functional medicine doctors will recognize this, the hormones start changing 15 years earlier. So if, for example, in my practice, you're a 35 plus year old woman, we're talking hormones because they're changing. Yep. And then what people don't realize too, a lot of these procedures like ablations or partial hysterectomies, they left in my ovaries. Yeah. No, you're in menopause. Yeah. No, you take body parts out. Yeah. There's problems.
There's issues, yeah.
There's issues. Yeah. Now those body parts may had to come out, but a functional medicine doctor can help you rebalance things.
Okay, hold on. I'm going to move this just a little closer because my eyes are really not as good as they once were. So I can't see.
You just put your hormone cream in your eyes.
Is that what I do?
No, don't do that. Don't do that.
I'm just teasing you. Okay. I love that because I think that's something that a lot of women aren't understanding, is that they don't have to be in menopause or in their 50s to start addressing some of the issues. Absolutely. And I also feel like in your 30s, your late 30s, a lot of women are experiencing these symptoms, but they're like, they have no clue what perimenopause is. But also, I don't think, for me, I was 42 and I probably had symptoms before that and just never realized it.
Or you didn't place it to those hormones because you were taught, your hormones are fine.
Yeah.
And that's the other area a functional medicine doctor will look at a little differently than a traditional is. The traditional lab values have normal values this big.
Yes.
And in reality, normal values are this big.
Yeah.
Based on age, sex, and history. And the basic scientific method, this is what always blows me away. The scientific method, when we do research, is to remove the observer. And you know what? We do that when we evaluate your labs as a traditional doctor. No, don't talk. Your labs are normal.
Yes, that's what every woman heard. So you don't need a lab test in order to be in perimenopause?
No,
okay.
No, absolutely
That's
not.
A good
You
one.
cannot see. We also in Western medicine. I'm a Western medicine trained doc. We are taught to treat labs and not people. And the functional medicine docs kind of look at that differently. Let's treat the person.
Yeah.
Let's listen to them. Let's bring that observer back in. Let's evaluate her labs with her talking to me, and then try to link the two.
Yeah, because we know our bodies.
You know
and
your
I
body.
feel like that's what a lot of women are just
You've been
not
in there the
even-
longest.
Exactly, right? Okay. I love this. This is already answering a ton of the questions that I get.
Good.
And a lot of women are just not feeling heard or seen because they'll go into their doctor, they'll have a 10-minute quick,
Wow, 10 minutes. That's
yeah,
pretty good.
right? And then it's all right if that, right? Okay, you guys are asking a lot of questions and I love those and we will get to those, I promise. I really want to just kind of hit the basics really quick and then we'll kind of get into some questions if that's cool with you. Okay, so tell me, okay, what was the next question I was going to ask you? Do you remember?
I
We
do,
kinda
but
get
you know,
into
can
it.
I add something else
Please,
on?
please do.
The other issue with the perimenopausal state and stuff is our environment. We are surrounded by these artificial estrogens that are changing you. Weight issues changes your hormones. That's why the powerful weight loss, the GLP-1s, like Mounjaro and Ozempic and those, also help balance the other hormones because of the weight-related issues that cause hormone problems. Thyroid issues are prevalent. I would say in my area, this is an empirical observation. So I just said observation twice. This is an observation I observed. 1 in 3 people in our area here, Lauren,
Really?
1 in 3 have subclinical hypothyroidism.
Really?
You have to
Why?
address that
Why do you
too.
think that?
There is, I had to call a friend of mine at the CDC out in Atlanta, and he pointed me to something called, in our area, something called, I just lost the name. They're basically nuclear waste dumps.
Oh.
There's 3 of them
We
within
have-
60
yeah.
miles.
I
of
was
here.
going to say we have some here.
Superfund
Yeah.
site. That's what they're called, Superfund sites.
Wow.
And there's 3 of them in our area.
I didn't realize there was
60
3.
miles away. And so, yeah, 1 in 3 people have subclinical hypothyroidism. So some of these, again, back to a doctor whose heart is there, wants to help you, but they look at your thyroid labs and go, they're normal. But you're not telling them it's normal. They're looking at a lab.
Yeah.
And that's where, again, functional medicine doctors, hopefully, and a lot of regular doctors, don't get me wrong, I'm certainly not cutting down people in our profession. Some of them need to be cut down, but we won't go there. Their heart's there, but they don't realize I have to listen to my patient.
Yeah, 100%. And I really feel like that happens
Yeah.
all the time. Which is interesting because I had a thyroid issue when I saw you. I had no clue. And you you deep dove, I felt like, into not only listening to me, but we did extra things, right?
We did extra things and found the issue. And
And now I feel much
Yep.
better. So, okay, so tell me this. Someone just asked, where do they find a functional medical doctor?
there's a couple websites. You can go to A4M, the American Academy of Anti-Aging Medicine.
Is it A4M?
The number 4M, or their website that I think has a doc finder on it is called worldhealth.net.
Okay, I'm trying to write these down. World Health, Health.net. And I'm just typing these, you guys. I'll make sure I post these. So
She
you can-
types with these huge nails.
I can't see,
I
and
can't
I
even
can't
do it
see.
without
I
nails.
literally, I need to go to that.
That's cool. That's
Thank
good.
you. I try.
Yes, and then the Institute of Functional Medicine, I can't remember their website, but if you type that in a search engine, you'll find it, and I know they also have a docs finder.
Okay, so is there a difference between a functional medical doctor and a doctor who specializes in hormones?
So a traditional trained hormone doctor is called an endocrinologist.
Okay.
Functional medicine docs are all trained in endocrinology. They are
Okay.
not endocrinologists, but they have a very good grasp of hormones
Okay.
because of the extra training we
Okay.
take.
So could someone go see an endocrinologist?
Yes, but if it's a traditional one, they're going to have the same issue we just talked about.
Okay.
They really are. They're wonderful docs, but they're treating labs,
Yeah.
and they're a specialist, so they're going to go next.
Next. So, okay, let's just kind of recap for everybody. You don't need a blood test to show that you're in perimenopause or menopause.
You don't. If you've been doing this as long as I have, I'll hear it. You'll tell me, and then I can use labs to confirm or deny what I'm already thinking. But I will never use the labs to make the diagnosis.
Yeah.
You're telling me what you're going through is far more important than what your labs are. So when you get old, like when I was young, I'd order labs on everybody, and honestly now I don't, unless the woman I'm working with wants to see them. She's going to tell me what's wrong.
Yeah.
And then we're going to
Okay.
go after it.
Okay, so really quick, because we didn't address this, can you tell them your background just a little bit, like where you've worked, things like that?
Oh, sure. So I did my residency at the Mayo Clinic I was a staff physician there for a very short time, opened up an anti-aging clinic in the late 90s, and just got way too busy. So my wife and I moved to where we live now in Idaho. I still did I was doing some fellowships and extra training in functional medicine the whole time, but my business partner, Randy, and we opened up a few medical centers, and now I'm full-time functional medicine.
Yeah, which is amazing.
Yeah, I've been doing it forever. I used to lecture all over the place.
Yeah.
Doing stuff. I write a lot of books and
yeah, I love that.
Have a couple coming out this January.
Yes, and we're gonna make sure. Like, I'm gonna put this all on my blog, and I'm gonna link back to all the things so you can find him. And he also has a podcast. We're gonna talk more about that as
we're starting to back up. Hopefully, the first of the year.
Yeah, which is amazing. Okay, so we'll keep you informed on that.
It's fun.
Okay, so we kind of talked about the basics: how to find a functional medical doctor, what is a functional medical doctor. What are some signs and symptoms that women need to kind of be aware of, or maybe they'll start noticing as perimenopause signs? Sure. There's a lot out there.
Right. Well, and back to our traditionally trained docs, they're listening for hot flashes, night sweats, dyspareunia, which is pain with sexual activity, dryness, mood changes, hair falling out, weight gain around the belly. Those are your classic menopausal symptoms, and those are all estrogen related. Perimenopausal women tend to show up with more fatigue, moody issues. Their periods are maybe normal, but they seem to change. They gain weight even though they're exercising like crazy. They're eating perfect, but they're starting that weight gain, especially in the belly again. Estrogen has the effect of keeping your womanly figure. If you imagine a prepubescent girl, she's straight.
Right.
Puberty hits, you have hormones, now you're curvy. Menopause hits, you go back to straight.
Yeah, yeah.
And so that's why if you start estrogen early enough, you won't go back to straight.
Oh, that's interesting.
And that's one of the reasons I like to have women start hormones earlier, because we prevent all those other issues from happening.
Okay.
Some of the other funny symptoms we talked about, one is body odor changes. Body odor can change.
Yeah.
And sometimes it's not pleasant.
No. It's not.
Hair changes. Growing hair where there's not supposed to be hair, and losing hair where you want your hair.
Yeah, I was going to say losing hair is a big one.
Yeah. Sexual function changes. Takes longer to reach orgasm, or you absolutely want nothing to do with anything, and you feel terribly sorry for your husbands. But you just don't want to be touched.
Yeah.
All those are symptoms that can be brought back into perimenopause. Of course, there's other potential issues, both environmental, personal, relationship-wise, that play a role. But if you're having some of those things, someone should look at you seriously and not just say, oh, you're fine.
Yeah.
You're fine. Oh, life's stressful.
Yeah.
Yes, it is.
Yes, it is.
But
but
I tell people all the time, I can't control your stresses, but I can help your body and brain deal with them better.
Right.
And that's what we try to do.
Right.
And that's where hormones play such an important role.
Yeah. Tell me this too. A woman's mom's history, does that play a big role in all of this?
Not really.
No.
Not really.
Interesting. So if my mom hit, I would say they weren't really aware of perimenopause, my mom's generation.
Oh, I agree with you.
So let's say they hit menopause at like 51. That doesn't mean I'm going to hit it at 51. So none of that matters.
No. The variables that matter in family history, and this, for example, there's no gene for diabetes. The reason people get diabetes is because they eat and don't exercise like their mom and dad did. It's an environmental thing.
Yeah.
So environmentally, if you eat like your mom, look like your mom, and then yes, you may have some very similar life traits as you get older, but a lot of people, especially younger women, your young age and stuff, we don't do what our parents did.
Yeah.
And so you cannot rely on mom having menopause at 51 and you doing it then, because you're a totally different person and a totally different set of variables are at play.
That's interesting. Because I've heard opposite, so that's why I wanted to ask you. But that makes total sense. Yeah. Okay, let me see if I have any questions. Can you add anything too if you... Okay, let's see. These are kind of specific, so I don't know. Do you want to go super specific? My daughter was on estrogen. The doctor said that's what caused her blood clot on her lungs. Could that be possible for that to happen?
Oral estrogen in the right person, or if they're a smoker, yes, that is possible.
Okay. Okay.
There's a lot of variables there.
Yeah.
But yes, that is possible.
It's probably hard to know without all the information too. I saw some more, so we're just gonna scroll back. Will you kind of talk about hormone replacement?
Oh, sure.
First of all, what it is, and then there's a lot of misinformation. So let's address that.
Yes. Isn't there everywhere?
Right?
So hormone replacement, if we're specifically talking the sex hormones,
Okay.
and the big ones are, there's 3 estrogens: estrone, estradiol, estriol. The estriol is the hormone of pregnancy, the estrogen of pregnancy. Estradiol is the hormone that's prevalent in childbearing age, so that's the one that kind of disappears in menopause.
Okay.
And then estrone, E1, is the hormone of menopause.
Okay.
There's testosterone, there's DHEA, and then there's a whole realm of other ones we use: pregnenolone, androstenediol, a few others that some of us that really specialize in this will dial in. But the big ones are estrogen, testosterone, and progesterone.
Okay.
I forgot that one.
Okay.
When you replace a woman's sex hormones, you try to balance it out to when they were 30-ish is what we're looking for.
Oh, okay.
We want to get that balance there.
Okay.
And that's a problem with like this person that asks about estrogen. If it's oral estrogen and unopposed, in other words, they're not on progesterone or testosterone or something else, then that risk is slightly higher for side effects.
Without being on progesterone.
Without having
so just
a balance.
estrogen alone.
Right.
Okay,
Yep.
interesting.
So hormone replacement by definition requires balance.
Mm-hmm.
It's not just taking the pill. It's not, birth control is not hormone replacement, although I heard a lot of people say that.
I'm so glad you
That's
said
called
that.
birth control, not hormone replacement.
There's so many doctors that's what they say.
Yeah.
That
yeah.
women, I get messages like that all the time.
Well, I liken it to, there's my car right out there. I'm going to put oil in it, not grape juice. And that's, if you're going to get hormone replacement, get the oil, not the grape juice.
Right.
It's
Like,
going to
do it
cause
right.
a problem.
Yeah.
Right.
Yeah.
So hormone replacement, by definition, is balance, using those different hormones in different levels. And then the cool thing about it is there's actually 8 or 9 different ways to deliver those, Lauren. So sometimes we mix and match.
Mm-hmm.
Oral estrogens I don't use hardly ever because of the risk that we just heard about.
I was
But
going to ask you
topical
that. Okay.
estrogens do not have that risk.
That's why you use
That's why I use a lot of
Okay, that was my
topicals.
question. Because I actually get asked a lot about why I have a topical.
Mm-hmm.
Okay.
Yeah, and topicals are nice too because we can control them. I think, if I may share, I think you have
Yeah, you're fine.
4 or 5 hormones in yours.
Yeah.
Where
And people don't understand that.
Yeah.
Yeah.
she has all her hormones in one simple cream she puts on, and it covers everything.
Mm-hmm.
So there's so many ways to deliver. We can mix and match based on the woman's needs, based on their history, based on their goals. For example, if your babies at home were all prepubescent, I probably wouldn't have used a cream because we want to keep kids away
We
from
talked
it.
about that, yeah.
Yeah, little kids go into puberty when they get into mama's hormone cream.
Don't want that.
Right away.
Don't want that.
No, we
Do
don't
not
want
want that.
But since your kids are all past
Yeah.
that bright old age.
So answer this because really quick, I actually had this question a lot when people see that I have a topical cream. They say, well, my husband, if he touches it, he is going to affect his hormones. Is that true?
He will not grow boobs.
Okay. No, seriously, this is like what I get this all the time. And so I'm wondering, like, does their estrogen go up if they, like, I'll put it on the inside of my arm,
Mm-hmm.
it's dried, my husband touches my arm, is that,
He will not be affected.
see, okay.
The dosing
That's what I
is
said.
awful low. If you were to put it on your belly, hop in the sack and get sweaty and rub all over each other,
That would
okay,
be
he
good.
might get a little.
Okay, but not to an
But
extreme
not
that is
to an
going to
extreme.
affect his hormones.
And that's why I joke with people,
Okay.
your husband's not going to grow boobs if he gets into this. And the creams all are completely absorbed within 2 hours.
Okay.
And as a general rule, we say put the cream on and cover it.
Mm-hmm. Yeah.
Just to protect other people that may be
Yeah.
hormonal sensitive.
Yeah.
But within 2 hours, it's completely
Okay.
unpassable.
Okay. Sorry that I
No,
interrupted you,
good.
but that's a question I had. Okay, so there's topical. What else?
There's pellets.
Pellets.
Pellets have been around since 1939. They're these tiny little rabbit food looking things, hence the name pellets. And we make a little incision, about 2 millimeter incision in your upper hip, put the pellets in, and they dissolve over 3 to 6 months, depending on a lot of variables there. But we do those with estrogen and testosterone. And if a woman still has her uterus, we add an oral progesterone. That's a great HRT regimen because they don't have to do anything but take a progesterone pill before bed at night, which helps them sleep and helps anxiety and everything else. And the pellets just dissolve.
Do you find over time that they work for a long period of time
Absolutely. I have a
It
couple
doesn't wear
women
off?
that I've been putting pellets in for almost 20 years.
and they still feel like it works?
They feel
well?
they love it,
Interesting.
yeah.
Okay.
Yep. There's patches, which I don't like too much. There's vaginal preparations. And if your problem is, as a matter of fact, I'm doing a lecture the first of the year on the effect of orgasm in menopause and how it changes. And one of the things I talk about in that lecture is systemic hormones will not help orgasmic response as much as local.
Okay,
So
go basic. Go really basic on
sure.
this.
So taking a cream right here on your arm or on your side or where Lauren does it, that has all your hormone replacements, that's systemic.
Okay.
That's for your whole body.
Okay.
If your problem is difficulty with orgasms and menopause, we put it right where it needs to be.
Okay. So you're just right to the
Yep,
root of the cause.
You got it right there.
I'm with you now.
And that tends to help more.
Okay.
So we'll use different combinations and stuff, again, based on history, based on need. I have a number of women that are on a systemic hormone, and they do a local hormone, vaginal hormone, 3 times a week, and they have an amazing sex life.
Interesting.
So there's those. There's
Is this a
shots.
cream? Wait, I'm sorry. I'm just
Good.
let's just ask, because I'm sure I'm not the only one wondering.
She just
here.
had a little light
I
bulb.
just have like,
Ding!
wait, is this like this is like almost too much? Sorry, it's like daytime TV here at this point, but whatever. Is it like a cream, like you just apply, or is it like something you?
We have both.
But,
We
okay,
have suppositories and then the creams. I
think
find
could
the
do that.
creams are much more efficacious. They work better.
Than
And it's a
the
small mouth than a
suppository.
suppository. Suppositories
Just
tend to
wondering.
melt and get all over the place.
Yeah, that's just okay.
That's,
I was thinking like a yeast infection. I was going there. Okay, sorry.
no.
Okay, keep going. Sorry.
That's okay.
It's my
There's-
kindergarten knowledge here.
Well, at least you don't have a teenage mind.
I mean, I don't.
I mean, we could have
don't
gone way
that.
down.
We could have. I have enough teenagers at home.
Yeah, you hear it all the time. There's shots. There's troches. Those are things you put under your tongue to dissolve. Let me see. 1, 2, 3, 4, 5, 6, 7, 8. There's suppositories, actual rectal suppositories. I haven't had a patient use those, but they are available. And then there's a pill we talked about. So there's 8 different delivery systems.
Okay.
So mixing and matching them based on the woman's need is a great way to really personalize it.
So you can mix and match depending on what they need.
What they need,
Okay.
yeah, absolutely. And that's why it's such a powerful intervention.
Yeah.
Because it clears your brain fog. It makes
Oh
your
my
mood
gosh,
better.
yes.
It,
The anxiety, the depression. Yeah.
Yes, it improves all that stuff.
It does.
Not to mention the benefits of wrist protection. Protects your heart, protects your bones, protects your brain, protects your husband, so you don't kill him. I mean, there's a
And
lot
your
of
family.
protection there.
It's like there's a lot going on. Okay, question. This one goes right along with it. What symptoms at 54 would you see in order to know if you need testosterone supplementation?
So testosterone is actually FDA approved for libido and sexual function in menopausal women. So the symptoms for testosterone would be, well, the testosterone does a lot. So I'll just give you from head to toe. It improves thinking, spatial awareness in particular. That's why us guys think we never need to ask for directions. And so it helps cognitive thought. It increases dopamine, so it does make you feel better, happier, more energetic. It builds muscle.
Yeah.
It burns fat. That's why your husband can miss a meal and lose 5 pounds, and you look at a meal and gain 5 pounds.
Lucky us.
Yes, exactly. It does help with libido, so the desire to initiate sex is improved with it, and then orgasmic response is also improved because for many reasons it increases blood flow to the clitoris in particular. It increases muscle tightness in the pelvic floor, so you have stronger contractions. And so everything opposite of what I just said, then you need testosterone. Did that make sense?
No, it totally did, and I agree with all of it. I think this is something that testosterone's not always talked about enough. I think from like a layman's standpoint, testosterone's looked at as like muscle builders use it. You know,
we all picture the East German women Olympic swimming team.
That's the rowers, you know, like
Yeah,
that's what I'm
exactly.
thinking. And so I think as women, I know for myself too. I mean, that was a scary like thing because I'm like, what is I gonna do? I don't want to be this bodybuilder. You know?
Right.
I want muscle. I just don't want that. Yeah, I want all the things. So I think that makes tons of sense. Okay. Recap. We've talked about what a functional medical doctor is, where to find one, what's the difference between an endocrinologist and a functional medical doctor. We've talked about perimenopause, how to know if you're in perimenopause, kind of the age range. We've talked about testosterone. We've talked about HRT supplementation and what hormone replacement actually is. Can you really quick, I don't want to touch too much more on that because we have a whole live on HRT, which you guys can go back and watch. We've done that one before. But tell me this, because so many women are still, which it kills me, so nervous to do hormone replacement. And I understand that in some cases it may not be for somebody.
Yeah.
But tell us, kind of like, let's debunk the myths.
Okay. I'm going to give you the Reader's Digest version, historically,
Perfect.
so it makes sense. Hormone replacement's not new. It's been around since the 18th century. Farmers used to grind up pig ovaries and feed it to their wives. I don't know who came up with that one, but true story.
For real?
Oh yeah, yeah. So pellets were the primary way that we utilized shots and pellets in the early 19th century. So estrogen was found around 1915, 1916. Testosterone was discovered by a couple German docs in 1935. 1939, the pellets were designed, and that's the way most doctors, urologists, and endocrinologists would replace hormones with pellets. In the early 50s, Premarin came out. That is an artificial hormone made from pregnant mare's urine, and that was the number one drug sold in the world for over 40 years.
For real?
Yep.
Wow.
Premarin, pregnant mare. Yep.
Ugh,
yep.
okay.
So what they started to see was a lot of uterine cancer. Because when you take estrogen, the uterus builds up, and if progesterone isn't there to slough it off, that can be cancerous, precancerous.
Yeah, right.
So they added an artificial progestin, not progesterone. God made progesterone, man made progestin.
Okay.
And to help stop that, and then we started seeing breast cancer.
Okay.
So in 1994, they started a study called the Women's Health Initiative. That wasn't me.
That motorcycle is so loud, I'm so sorry.
That's why I had to claim I didn't do it.
I was like, pause for a minute. Oh, it's a truck.
The Women's Health Initiative was stopped in 2002, early in the year, because they noticed an increase in breast cancer.
Okay.
Scared the bejesus out of everybody, and they preached it like crazy. And I could go into so much detail with the flaws of that study.
You did in our HRT one.
Oh, did I? Good.
Yes, so make
good.
sure you guys go back, and I can even put that on my page too.
Yeah, it was just a bad study with bad outcomes, because so many women have suffered the last 20 plus years.
Because of that study, right?
Yeah. And now jump fast forward, the American Menopause Association, the American College of Gynecology and Obstetrics, all these big organizations are coming out and saying hormone replacement is appropriate for some. And which was a total complete turn, where you shouldn't use it at all because everyone gets breast cancer. That's an absolute lie.
Okay.
Absolute lie. So everyone has independent risk factors. This one including family history. Family history is very important with this one. But your lifestyle is even more important.
Then your family history.
Then your family history.
Interesting.
Only 5% of cancers have a direct family history link.
Wow.
So it's our environment. Not eating right, high stress, no exercise, poor sleep, bad relationships. That's what starts cancer process.
Okay.
So if a woman's scared of it, I would encourage you to find someone who knows their stuff, functional medicine doc, who can explain the risks and benefits for you personally. It is not appropriate for me or anyone else to give you a broad statement on safety, because I don't know you.
Right. And everyone's different.
Everyone is different, and their backgrounds are different, and the direction they're going is different.
Right.
There's a lot, but the cool thing is, and this is where so many people are missed, there are so many options.
Yeah.
I have a number of women who've had breast cancer on hormones.
Really?
They're doing wonderful. Their quality of life is great. And I have a number of women that had breast cancer and don't want hormones, and we're doing all sorts of things trying to improve their quality of life. We can do it, it's just a little harder. Yeah.
So you don't have to suffer.
No.
You don't have to suffer, you guys.
Yeah, you know what? We forget quality of life, because when God says you're done, you're out of here.
Yeah, but there's just so many women just suffering because they think there's nothing, and there is.
So much we can do.
I wanted to answer. Someone just said, "Is there an age that's too late for hormone replacement?" I think I know the answer because we talked about this a long time ago. But
say it again.
Is there an age that's too late for hormone replacement?
If you're breathing, you qualify.
Okay.
I have 80s, late 80s, women on hormones.
And we should be on it, right, for our life.
Absolutely. I get back to my oil in my car.
Yeah.
Oh, my car's now 65. I'm going to stop putting oil in it.
Doesn't make sense, right? And there's isn't there a lot of research with brain, like with dementia, things like that, for women being on? Yeah.
Absolutely. Now, again, back to the individual. If a 65-year-old woman for the first time ever is starting hormones, there are a different set of risks there. But that's what you meet someone like myself, we talk about those. And how do we negate those?
And that's why you need someone who's listening too.
Right. And that's why also too, if I may, Lord, I like starting women earlier, because that risk is negated if they stay on it their whole life versus starting it later in life. I do have to talk to them about a few things.
Okay, that's good to know too. I didn't know that. I just had a question and then I lost it. My doctor told me it's the symptoms up until you hit full-blown menopause. I'm at that asking age. Do you?
Your symptoms.
I don't understand that.
I don't either.
I think they're saying...
Maybe they said you don't have symptoms until you're full-blown menopause.
Maybe that's what that means. That's not true.
Someone needs to talk to that doctor.
Yeah, that's not right. That's misinformation. Find somebody else.
Yeah.
Wrong doctor. I say that all the time. I'm like, get a second opinion.
I like that.
Okay, let me make sure we're not missing anything else. So I feel like that was just a really good, quick on hormone replacement. You do not need to suffer. That's the biggest thing here, right? You do not need to suffer. If you do not feel like you got to find someone.
And if I may add, Lauren, this
please.
is one of the books I have coming out next month. Really focuses on this. For so many years, I've been doing this a long time, and I would always start with diet and exercise. You need to eat right, you need to exercise. Women that are in this stage don't feel like eating right and don't feel like exercising.
Right.
So one of the greatest things you could do for someone like that, help them balance their hormones, they feel better, and lo and behold, they start eating right and exercising.
Yeah.
So
No,
really,
it is so true. It is so
if
true.
you feel good, you'll do that stuff.
Yeah.
If you try to start with that stuff, you're going to fail.
Yeah.
You're going to fail.
Because, our minds are not right at
No,
that point.
exactly.
Like,
no, and food is our drug at
Yeah.
that point too.
Yeah, 100%.
100%.
That sugar, all of that. That's what we...
Give me my serotonin.
Yeah. Okay, let's do a rapid fire because we've been on here for a little bit. Don't want to take too much of your time. Okay, rapid fire. Ladies, this one's for you. These are the questions and the symptoms I mainly get on all my videos. I'm going to kind of just throw out a symptom, and I want you to give me really as brief as you can what someone could do.
Okay.
It's going to be hard. Okay, we're going to start with frozen shoulder. That is number one. So many women are complaining about frozen shoulder. What do we do?
That's a lubrication issue. So hormones actually will help. Testosterone in particular. Testosterone increases something called interleukin 10, which is a very powerful anti-inflammatory. And then strength training.
Okay. Does estrogen play any role in frozen shoulder?
Indirectly, yes, absolutely. That's why I say hormone balance is essential.
Okay.
The book I have, I can't tell the title yet, but it addresses just that.
Okay.
Not necessarily frozen shoulder, but why does these hormones help that type of thing? Why do hormones help musculoskeletal things so well?
Okay, so what if someone is on hormone replacement and they still have this frozen shoulder? What would you suggest that they do?
I'd have to see if is it an anatomical issue, is it a muscle strength issue, is it some sort of imbalance? I have to know a little bit more to tell you.
Okay.
But there's so much more. Functional medicine docs, a lot of us do neurotherapy and prolotherapy, prolozone. We use placental-derived connective tissues, which are exosomes to help rebuild tissue. There's so many things you can do. Yeah. But you have to have that balance on the inside for that stuff to work the best.
100%.
Right?
Yeah.
Yeah, that's why everyone goes and gets a steroid shot from the orthopod. They feel great for 3 months and they're right back where they started.
I tried everything before I saw you, remember?
Yeah, yes.
When I saw Dr. Willey, I couldn't move my shoulder past here. And now I've got full range of motion. But I tried everything. Acupuncture, physical therapy, steroids, cortisone. You name it, I had done it. And until my hormones got balanced, and I got in the gym and I did light strength training.
I gave you simple exercises.
Simple exercises, a lot of stretching. It started slowly coming back, and now I have full range. So,
Yep.
yeah. Okay, next one. We kind of talked about this. Low libido.
So
what do we do?
You have to remember the biggest sex organ you have is between your ears. So libido is defined by people differently. I define it as the desire to initiate.
Okay.
All right, the desire to initiate. Because a lot of women say I have no libido, and my question right away is, well, does everything work? In other words, when they're actively sexual, do they lubricate okay? Can they reach climax? If they say yes to those, it's not a hormone issue, it's a brain issue.
Interesting.
It's very likely a relationship issue. And so working with the relationship, working with the counselor even, it does wonders for libido. But also getting those hormones balanced can help. Like we mentioned earlier, testosterone increases libido, increases dopamine, so you feel better,
Right.
improves orgasmic response. And that's one of the things that's important to understand too. If you want to have an orgasm, you need to have more orgasms.
Practice.
Does that make sense?
Practice.
So if you're having sex once every 6 months,
Oh,
well, no wonder you don't want
I mean, that makes sense, yeah.
right? So, but 1 or 2 a week, and then you're more inclined to have libido because you want more.
Right. Okay. That was a quick answer. We'll have another segment, maybe another.
Oh gosh, we could do 2 hours.
We could do a lot on that one. I'm just let us know if you want that. Okay, let's do itchiness. I don't know if these go together. Itchiness and tingling, pins and needles. A lot of people say that.
Body or vaginal area? Body. That's usually a histamine type thing related to your gut health, which is also tied into hormonal health because your hormones are processed through your gut. And everyone's gut. You live in America, you have a gut problem.
Yeah.
Even if you go to the bathroom normally, you don't have bloating or belching or farting or anything like that. Can I say fart?
You did.
Okay, thank you. That's a metaphor. It's a gut problem. So looking at something called, there's a number of gut health tests we can look at histamine levels. You can even do a CBC and see what the totally eosinophilic count is and know if they have a problem. So that's a gut issue. But again, back to that balance, everything balanced, the gut heals.
That is so true. So true. Okay, let's talk weight gain really fast. That's a big one too.
That's a big one.
It's a big one. What can someone do right away?
Get your hormones balanced. So you feel good, because then you're going to do the stuff you're supposed to do.
Yeah.
Your eating changes, your movement changes, but you got to feel good to do it.
Yeah.
You really do. And that's why the hormones are so important, because the lack of estrogen, just estrogen alone, not to mention all the other ones, doesn't necessarily cause the scale to change, but like I mentioned earlier, it changes your body shape, especially in the truncal area. You lose your womanly curves and go to a horn. If you get your hormones balanced, you'll get those curves back. You feel better about yourself, you exercise more. You exercise more, you eat better.
Yeah. You want to get out of bed.
You want to get out of bed and do stuff, so yeah.
Okay, so what if someone is exercising, they're on hormone replacement, they're eating well, they're still gaining weight?
The hormones need to be looked at again.
Yeah?
Yeah, especially after, and you've heard me say this, Lauren, especially after the age of 40, ladies, you cannot undereat your fat and you can't overexercise your fat.
Yeah.
Calories are important, but it's not a caloric issue.
No.
What happens when you cut calories too far is you lose all your muscle. We've seen that. Look at Ozempic butt.
Yeah.
Those people are not balanced.
Yeah. Yeah.
And that's going to be a problem in the future for them. So it's such a much big picture.
Okay.
So.
Okay. No, that's good. Another time.
Oh my gosh, yeah, that's another one I can go on.
I feel like we did do one on that as well. I'll have to go back. I think
we talked about it. Yeah.
I think we did. Okay, I'm trying to think really quick a couple other ones that I get all the time. So, depression. Anxiety, depression.
Huge, right? So yes, your hormones are so involved in that between your ears. It's not just serotonin. Everybody thinks we're Prozac deficient. You're not Prozac deficient. The testosterone, again, bringing that up, increases dopamine. You're happy, go get them hormone. Hormone balance does wonders. Estrogen, great studies on it helping with depression. Progesterone is the anti-anxiety, my go-to anti-anxiety for men and women. I put men who have bad anxiety on progesterone and their anxiety gets better.
Interesting.
Yeah, it's very calming. It's a direct precursor to, it goes from progesterone to norepinephrine to GABA. Okay. And GABA is your gamma aminobutyric acid. God gave you 15 or so hormones to run away from a saber-toothed tiger and one hormone to go to sleep. That's GABA.
And I feel like we do not have that as we get older.
That's right. No, you don't.
I could stay up all the time. It's like ridiculous.
GABA
but is I'm tired.
So important.
Okay, so someone just said, what was it? And I was like, I just lost it. Oh, what about DHHB for anxiety? I swear by that since you put me on that.
DHHB is magnolia bark, which is incredible. I call it God's Valium.
Yeah. Because
it works just like Valium, but you don't get addicted.
Just feel calm.
Yep, you don't fall asleep with it. The stuff's incredible.
It is. I say this all the time, and so I really wanted you to address that because it is probably the only thing that I would say supplement-wise. If you were going to spend your money on one thing and you had anxiety, I swear by that.
Couldn't agree more.
It's the only thing my husband's noticed too. He's like, "Whoa, you are just chill." I'm like, "Yeah, I feel great."
Yeah.
But it's not like I'm not me at the same time, right? Yeah.
And the traditional doc would write you like Ativan or lorazepam, Xanax, which is alprazolam, or put you on an antidepressant.
Yeah.
Mongolia bark. It's incredible.
It's amazing. Amazing. I can't say that. Okay, really quick. Brain fog, scatterbrained. You're type A personality. You never had to make lists before. Now you're making lists. You're forgetting everything. What do we do right away?
I would, again, since this is a hormone talk, I would say get all your hormones balanced. It'll make a huge difference. And then if there's still some of those issues, then we can address those directly. But just remember, ladies, it's not abnormal to lose your car keys. The problem is when you forget what your car keys are supposed to do.
Really?
Yeah, absolutely.
It gets to that point.
Oh yeah.
See, I'm still like I don't know where my car keys are.
That's okay. Yeah. That's normal.
Okay, that's normal.
That's scatterbrained.
So
both of us.
Is that age in general?
Where are my keys, by the way?
You're staying here. But is that age in general?
Like, it can be, but it's something that we can address and improve on.
Yeah.
The brain is so plastic, you can grow brain material left and right. It's called dendritic pruning. And DAHB, Magnolia bark, actually helps improve the brain.
Oh,
Not only does it help anxiety, it actually helps the brain.
Okay. I missed what you called it for depression and anxiety. That was GABA, right? Is that what
GABA, yeah. Gamma aminobutyric acid, GABA.
Yeah.
That's your calming hormone. And that's the hormone that alcohol works on. That's the hormone that Valium works on, Ativan works on. But those things all have bad side effects, which we're very aware of, like addiction. You can't get addicted to Magnolia bark.
Okay, and then someone said DHT.
Or progesterone.
Right. Okay, I'm going to give it to you. One more symptom that you feel like almost every woman comes into you with.
Fatigue.
That is true. That's
fatigue. Fatigue's the number one reason people seek primary care now, I think.
Is that like one of the first things people notice, do you think?
I do.
I
think
it's
way up front. And there's a lot of variables behind that. But again, going back to the gist of our whole discussion, balance is how we fight that. Mm-hmm. And fatigue, to me, ladies, is an emotion. It's energy drain and stuff. It's something that's different to those of us that practice metabolic medicine. Fatigue is an emotion. And so I have to understand when I'm sitting in the room with you, what is this emotion mean to you? And then we can address it directly. Is this a true metabolic energy depletion? Like every woman that's insulin resistant has true energy issues because that messes up the mitochondria, the little energy houses. But if they don't, is this something else? Is this dopaminergic? And there's medication and supplements we can even try. And if you get 100% better, now I know what this is. This isn't metabolic fatigue, this is emotional fatigue.
Okay. And I think just with life in general,
we're
all just...
All of us are overworked,
especially right
underpaid.
now, right? Oh my gosh. Okay, one more. I'm so sorry, because this lady has asked, a couple of people have asked. Joint inflammation in the ankles, hands, and fingers, also swollen ankles and hands. Oh. Joint inflammation. How about we just cover that?
Yes, absolutely.
Is that normal for perimenopause?
Very normal. Okay. Yeah, I shouldn't say it's normal. We see it a lot, but it's very fixable. Okay. Very fixable. And as part of that bigger picture, get rid of the toxic fat. Make sure your liver's not fatty, what we call non-alcoholic fatty liver disease. Your hormones are balanced, your thyroid is working appropriately, and you're moving.
And that can also, processed foods play a huge part in that, right?
Oh, yeah. And it's funny, if every time I direct someone to start keeping a food log and their symptoms, everyone finds a food that does something. And that's something we were not taught.
No, that's
we don't relate that. And mine is rice. And you know how much I love sushi. I'd eat sushi 24/7 if I could. Yeah. But when I eat rice, I wake up the next morning, my ankles are stiff.
That's so interesting.
Keep a diary, and you'll find your food that does that. Now, that doesn't mean, in my world, rice is bad. It means I have some gut issues I probably should work on, but I'm too lazy right now because there's too many cookies out.
Yeah,
it's Christmas.
It's Christmas.
I'll work on it later.
We also have to have a balance of enjoying our lives.
Yes.
There's all these things we should be doing, but let's be honest. Go see my post I made last night. We don't do it. We're not. Okay, exhausted constantly. I'm eating so good. Yeah, the exhaustion, eating so good, all the things, right?
Oh yeah, it's back to all those other reasons there.
Get your hormones checked. So, okay, we're gonna stop because we could talk.
We could go
we
forever.
really
We
could
talk
talk, and we
forever.
could just be here all day.
Yes.
But let us know in the comments if you want us to do another live. What do you want us to talk about? What do you want us to address? We can definitely do even more like specifics.
Oh, absolutely.
And I will make sure that I link back to Dr. Willey's website, and when his new book comes out, we'll make sure we do some combos on
Cool.
that.
Yeah.
Okay.
You know, at 10 to 1, it's going to be totally free online. Because I have so many books I've written. Look at all those over there.
I know. He's
and
amazing.
These, I've just decided that there's so much misinformation out there. I don't want people to have to pay for something that's genuine. And to me, it makes it more genuine if I'm not making money on it.
Yeah.
So,
So
it will
true,
be
yeah.
available. It'll be a link that I make sure Lauren has, so all you wonderful people can have it.
That's what we love about him. He's here to serve women, to help women. I mean, genuinely, that's what he's doing, is helping women. So we just appreciate your time so
thank
much.
you, my dear. And I like guys too.
Yeah.
I'll
he
try to
does.
help the husbands.
He does. He's actually really good at that too. So he does both.
And they need more
If
help
you're
than you girls
local.
do, trust me.
If you're local. So, all right. Well, thank you so much, you
Yes,
guys.
thank you.
I will make sure I put all this information. I usually have you guys comment a word to get all this information, but I'm not there today. So I'll do my best to get you all the information and link you to where we can go. I think we should do a whole thing on GLPs another time. That's
Oh,
what someone's
sure.
asking.
Oh, I can go on forever.
Because I
on
think those are actually really interesting, and there's so much research, like new stuff coming out that actually are making them not as bad as like we kind of think. So
Lauren, I've been writing those since 2007
he's ahead of the times, you guys.
for weight loss.
Yeah.
They are not new.
No, it's just because of the media, huh? Anyways, okay, see, we're going to keep going. All right, love you guys. We will see you another time. Bye.
Bye.